Did you know that Tourette's is far from the only tic disorder? Tourette's syndrome is a neurodevelopmental disorder as well as the most common cause of tics. However, several other disorders have been associated with tics and tic-like movement. As of the present time, there are three primary tic disorders that are divided into three categories according to the DSM-5 and ICD-10. Provisional tic disorder, previously known as transient tic disorder, is a tic disorder in which the person experiences seemingly involuntary motor and/or vocal tics for under 1 year. Persistent motor or vocal tic disorder is a condition in which a person experiences single or multiple occurrences of either motor or vocal tics, but not both. Tourette syndrome is a condition where both motor and vocal tics have been present for more than 1 year. Additionally, there are studies of secondary tic syndromes and disorders. These have been labeled as secondary due to the fact that they occur as a secondary consequence of another underlying medical issue. Many conditions present with secondary tics. Some that come to mind are things such as developmental disorders, neurodegenerative diseases, substance abuse, pregnancy, autoimmune disorders or infections, medications, various toxins, and so on. Tic categories. You may be familiar with the terms motor and vocal tics, but additionally, there are two categories you can sort these by: simple and complex. Simple tics are abrupt, brief, repetitive movements or vocalizations that involve only a few muscle groups. Examples of simple motor tics include head or shoulder jerking, shoulder shrugging, nose twitching, eyes blinking, rolling, squinting, grimacing, and so much more. Complex tics are specific, coordinated patterns of movement involving several muscle groups across various parts of the body. Because they're more coordinated, complex tics can seem more deliberate or purposeful rather than involuntary. Although complex tics still involve repetition, the movement pattern is longer than with simple tics, and in some cases, it may even look like normal activity. Some examples of complex tics include hopping, kicking, bending, twisting, sticking out the tongue, touching objects or people, making rude gestures, and other various examples. Examples of complex vocal tics include things such as repeating one's own words or phrases, palilalia, repeating words or phrases others say, echolalia, or swearing or using vulgar language, coprolalia. And this too, of course, is not an exhaustive list. Last but not least, the difference between tics and stims. One of the key differences is that stims lack the presence of a premonitory urge. Premonitory urges are uncomfortable feelings or sensations preceding tics that usually are relieved by a particular movement. Individuals with tics may have either a generalized or localized sensation of tension that is relieved by the tic. Like tics, stims, or as they're known clinically, stereotypies, are similarly described as repetitive pattern-like movements. Stereotypies were previously thought to lack purpose, although this latter interesting feature can be challenged as studies show that stereotypies are often triggered by excitement or used as self-stimulation behavior. Tics are less predictable and have no functional goal, whereas stimming behaviors serve a purpose for self-regulation or even expression. If anything I said resonated with you, I'd really appreciate if you could like this video.